First of all, let's learn about the cycle of reproduction. Acquiring a sound knowledge about the reproductive systems of both male and female will give you a good understanding on family planning. The male reproductive system consists of penis, testis, vas deferens, seminal vesicle, prostate gland. The penis and two testes are located outside the pelvic cavity, while the vas deferens, seminal vesicles and prostate gland are placed inside the pelvic cavity or pelvis. Sperms are produced in the testes. These sperms travel through the vas deferens and get stored in the seminal vesicles. During ejaculation, sperms and secretions from the seminal vesicles and prostate gland come out of the urethra as seminal fluid. This is known as sperm fluid. Approximately 300 million sperms come out during ejaculation. Next, the female reproductive system is shown. Ovary, fallopian tube, endometrium, uterus, uterine cervix and vagina are parts of the female reproductive system. The parts of the female reproductive system, namely ovaries, fallopian tube, uterus and cervix, are placed inside the cavity. The size of the uterus is usually that of a clenched fist. During pregnancy, the uterus enlarges with the growth of the fetus. An ovary is usually the size of an olive. The two ovaries produce ova and female reproductive hormones, estrogen and progesterone. Usually, one of the two ovaries releases an ovum once a month. This is called ovulation. Ovulation usually occurs about 14 days prior to the onset of subsequent menstruation. Ovum stays inside the fallopian tubes for approximately 24 hours. After that, the ovum travels through the fallopian tube towards the uterus. If the ovum is not fertilized, the inner lining of the uterus or endometrium gets separated and menstruation occurs. This process is called menstruation. During this period, there could be some pain in the lower abdominal area. Flow of menstrual blood and birth of a child all occur through the vaginal canal. It is important to understand hormonal activity. This process occurs from menarche to menopause. Menstrual cycle is controlled by two hormones produced by the pituitary gland. The female reproductive hormones, estrogen and progesterone, are secreted by the ovaries under the influence of the pituitary hormones. During the first half of the menstrual cycle, the inner lining of the uterus grows under the influence of the estrogen hormone. During the second half of the menstrual cycle, blood supply and secretions of the inner lining of the uterus increase, mainly under the influence of the progesterone hormone. If the ovum does not get fertilized, the inner lining of the uterus gets separated and menstruation occurs. If the ovum gets fertilized, it gets implanted in the uterine wall and grows as the fetus. The union of sperm and ovum usually occurs in the distal half of the fallopian tube and is called fertilization. The fertilized ovum is called zygote. It travels along the fallopian tube whilst undergoing divisions towards the uterine cavity. The developed zygote comes to the uterine cavity and gets embedded in the uterine wall. This is called conception. Development of the fetus. The fertilized ovum or developed zygote, which is implanted in the uterine wall, develops as the fetus during 6 weeks. During 8 and 10 weeks, the developing fetus is nourished by the placenta. During 12 to 14 weeks, the fetus grows approximately 11 centimeters and most of the organs are developed. By the 24th week, the fetus is about 30 centimeters in length. By this time, all the organs are differentiated and formed. Stages of labor. The growth and development of the fetus is around 40 weeks. In a normal delivery, the fully developed fetus is delivered head first through the vaginal canal. There are 3 stages of labor. Firstly, the uterine cervix gradually dilates up to 10 centimeters in diameter. Second, the baby is delivered through the vagina. And thirdly, the placenta is delivered. Using a contraceptive method helps you to prevent an unplanned pregnancy. There are many contraceptive methods. They are divided into 3 main categories as modern, natural and traditional methods. Modern methods are divided into 2 categories as temporary and permanent. Temporary methods could be divided as hormone and non-hormone. Examples for hormone method are oral contraceptive pills, injectables and implants. Hormone methods could be used up to 50 years. Intrauterine device or the loop and condom are non-hormone methods. Under modern methods, the permanent contraceptive methods are female and male sterilization. Natural contraceptive method was introduced as the second method for family planning. Under the natural method, there are standard day method, basal body temperature method, cervical mucus method, symptothermal method and lactational amenorrhea method. Abstinence and discharging sperms outside the vagina, withdrawal, could be cited as traditional family planning methods. One pack of oral contraceptive pills consists of 28 tablets, out of which the first 21 tablets contain hormones and the other 7 tablets contain iron. Oral pills prevent conception by inhibiting ovulation, increasing the thickness of the cervical secretions, thereby obstructing the sperms entering the uterus and making the uterine wall unsuitable for implantation. Oral pills should be taken within the first 5 days of menstruation. The first tablet should be taken as indicated in Figure 2. Oral pills should be continued as indicated by the arrows on the pack until the pills, including the iron tablets, are over. Pills should be taken after dinner. Oral pills should be continued as indicated by the arrows on the pack until the pills including the iron tablets are over. On completion of taking the pills in the pack including the iron tablets, start on a new pack by taking the first tablet as indicated in the figure and continue thereafter. Taking the pills every day at the same time ensure an effectiveness of 99%. Return to fertility is immediate. A checklist should be used to screen clients before recommending oral pills. Injectables contain the hormone progesterone. It prevents conception by inhibiting ovulation, increasing the thickness of cervical secretions, thereby obstructing sperms entering the uterus and making the uterine wall unsuitable for implantation. This method should be commenced preferably within 7 days of onset of menstruation. Injectables can be commenced 6 weeks after childbirth. Obtaining an injectable every 90 days would ensure an effectiveness of 99%. Women who obtain injectables may experience changes in the menstrual bleeding, such as spotting, irregular bleeding, heavy bleeding or amenorrhea. Return to fertility after discontinuing this method occurs around 7 months. It is important that the consumer should undergo a medical examination prior to commencing injectables. Implants containing progesterone hormone are injected by a trained medical doctor just below the skin on the inner side of the upper arm through a small incision. By this method, conception could be prevented up to 5 years. The implants should be removed after 5 years. If needed, these could be inserted again. This method should be commenced preferably within 7 days of onset of menstruation. Implants can be inserted 6 weeks after childbirth. Women who have inserted implants may experience changes in the menstrual bleeding, such as spotting, irregular bleeding, heavy bleeding or amenorrhea. Effectiveness is about 99%. The return to fertility is immediate after removal of the implants. The intrauterine device or loop or IUD is a small flexible device made of copper and plastic. It prevents pregnancies for 10 years. It should be removed after 10 years and a new IUD may be inserted if needed. The IUD is inserted by a trained medical doctor or public health nursing sister within 12 days of onset of menstruation. An IUD can be inserted 6 weeks after childbirth. The IUD prevents fertilization and implantation. Side effects such as lower abdominal pain during the first few days, spotting during the first month, and prolonged menstrual bleeding during the first few months may occur after insertion of an IUD. This situation will ease out with time. This method is 99% effective. The IUD could be removed at any time at a clinic. Return to fertility is immediate after removal of IUD. The condom is a rubber sheath which is used to cover a man's erect penis during sexual intercourse. A new condom should be used for each act of sexual intercourse. It prevents deposition of sperms in the vagina by acting as a barrier. Be mindful about the date of expiry of the condom. Do not use the mouth to tear the packet. The use of condoms protects against sexually transmitted infections and HIV/AIDS. Condoms can be used with other contraceptive methods as well. A condom should not be unrolled and examined before use. There should be no contact between the penis and the vagina before the condom is worn. Open the condom packet carefully and take the condom out. Place the unrolled condom to cover the end of the erect penis, keeping the rolled rim faced upwards, and press the teat at the end of the condom with the fingers. Unroll the condom over the penis to cover it completely. After ejaculation, hold the condom at the rim and remove the penis from the vagina while the penis is erect. Carefully remove the condom before the penis gets flaccid and dispose of it in an appropriate manner. If used correctly, the efficacy is more than 97%. To ensure this, the contact of vaginal secretions with the penis should be prevented when removing the condom from the penis. Used condoms should be wrapped in paper and disposed of appropriately out of reach of children. Do not dump them in toilets. There are condoms used for women, but these are used very rarely. Female sterilization, or the LRT operation, is a permanent contraceptive method. Here, the fallopian tubes are occluded by a minor surgical procedure. Occluding the tubes prevents the meeting of sperms and the ovum. The husband and wife should come to a well-informed decision regarding the sterilization, as reversal of this surgical procedure is very difficult. The husband and wife should sign the form H1198 consenting to the sterilization surgery, and it is important that they should satisfy the eligibility criteria. The prevention of conception is immediate following surgery and efficacy is 99%. There are no long-term complications. No change will occur in the menstruation or the production of hormones by the ovaries. Male sterilization or vasectomy is a permanent contraceptive method. The vas deferens in both sides are ligated and resected by a minor surgical procedure. The occlusion of the vas deferens prevents emission of sperms. However, the secretions from the prostate gland and the seminal vesicles emit as before, and the sexual process, including erection and sexual satisfaction or orgasm, will not be affected. No effect on your ability to do strenuous work. The husband and wife should come to a well-informed decision regarding the sterilization. They should sign the form H1198 consenting to the sterilization surgery. A backup contraceptive method such as condoms, injectables or oral pills should be used for 3 months following the surgery, as sperms already stored in the seminal vesicles can continue to emit. The effectiveness is 99%. Natural methods. Natural methods are not as effective as modern methods. Therefore, the failure rate is as high as 20 to 30%. A woman who has a 26 to 32 day menstrual cycle, the period from the 8th to the 19th day is considered the fertile period. If there is sexual intercourse during this period, the sperms may travel through the uterus towards the fallopian tube and union with an ovum results in conception. Avoiding sexual intercourse during this period may prevent conception. Sexual intercourse in the first 8 days of the menstrual cycle and after the 19th day of the menstrual cycle may not result in conception. This method is also not as safe as modern methods. This method is based on the increase of body temperature associated with ovulation. Following ovulation, the body temperature rises 0.2 degrees centigrade to 0.4 degrees centigrade or 0.4 degrees Fahrenheit to 0.8 degrees Fahrenheit and remains elevated till the next menstrual period. A special thermometer, preferably digital, should be used for this purpose. This method is also not as safe as modern methods. This method is based on the recognition and interpretation of the changes in the cervical mucus according to the changing levels of estrogen and progesterone hormones. This method combines 2 or 3 natural methods mentioned earlier. This method identifies the fertile period more accurately. Emergency contraceptive pills. The following regimens can be used to prevent unplanned pregnancies after unexpected, unprotected intercourse. Taking the pills in the packet together, or taking 4 oral contraceptive pills within 120 hours of unprotected sexual intercourse and repeat the same dose after 12 hours. The effectiveness is increased by taking the pills as soon as possible following unprotected intercourse. The failure rate of the emergency pill is 5%. If by any chance conception occurs, the fetus will not be affected. Lactating mothers can also use this pill. It is very important to note that this method should be used only in an emergency situation, as high doses of hormones are administered at once. This method is not recommended for frequent use. For regular sexual intercourse, family planning methods should be used. Post-conjugal. Third method is to insert intrauterine device within 120 hours or 5 days. This method prevents pregnancies for 10 years and is the ideal post-conjugal contraceptive method for women with children.